All right, hi everyone. For those of you who don't know me, my name is Chen. I am an associate professor here at the law school. I'm really pleased today to be joined by three very knowledgeable and, dare I say, tenacious advocates who will speak to migrant workers specifically, right to health care from the perspective of their lived experience, right? I don't think that we at the law school often hear that perspective. Many of my students probably will be tired by this point to hear my perspective. It's often good to have a different standpoint on this issue. So welcome to this conversation. Before I hand it over to our panelists, I'm going to briefly introduce them to you in the order that they will speak. First of all, we have Stacey Gomez, who is the co-founder and executive director of the Center for Migrant Worker Rights, Nova Scotia. Since 2021, the center has provided supports and services to over 6,000 migrant workers throughout that province. Stacey has been active in movements for gender justice, corporate accountability, and migrant rights for over 15 years. Her experience includes frontline service provision to survivors of sexual violence, organizing anti-deportation campaigns to keep migrant families together, and coordinating a national coalition advocating for better Canadian policies in Latin America. She's also a first-generation university graduate with degrees from University of Ottawa and York University. Then we're going to hear from Kerian Burnett, who is a cancer survivor and former migrant worker from Jamaica, who was employed on a Nova Scotia strawberry farm in 2022. While battling cancer, she did not have public health care coverage for life-saving treatment. She bravely spoke out publicly about her story. You probably see her story in the media, shining a light on the healthcare inequalities faced by migrant workers. And after months of organizing, she was ultimately successful in her application for the interim federal health program. And for all her effort, just recently, yesterday actually, she was awarded the inaugural Neil Toussaint Award for Universal Health Care by the Canadian Health Coalition. Kerian is also a mother of 6 and grandmother of 2. Okay. And finally, we have Gabriel Allahdua, who is also a former migrant farm worker from St. Lucia. He has been an organizer with the Collective Justice for Migrant Workers for almost a decade. He is currently an outreach worker working with the migrant workers across Ontario and the Education and Mobilization Officer with the Association for the Rights of Household and Farm Workers. Previously, he was activist in residence at the University of Guelph, the first person to hold that position, which brought activists and researchers together. He's the author of the recently published award-winning book called Harvesting Freedom, and that was published by Between the Lines, if anyone wants to check that out. Okay. All right, so I'm going to pass the microphone now to Stacey, who's going to talk to us generally about the policy about healthcare access for migrants first, setting the stage before handing it over to Kerian to talk about her experience.
Great. Thanks, everyone. It's good to be here at the university that I graduated from. From being in a classroom to now sharing around our experiences in Nova Scotia. The organization I work with is the Center for Migrant Worker Rights, Nova Scotia. And I just have a few slides I wanted to share. To start off with, I want to share a bit about the work that our organization does. One is doing outreach to migrant workers throughout the province in person so that they know that there's an organization they can turn to if they have any issues that come up, as well as providing rights education, support services in vulnerable situations, whether that's situations of abuse, workplace injuries, medical emergencies, community building, because migrant workers are often isolated in rural areas throughout the province, may face racism in communities where they're living. And so we try to build bridges between migrant workers and Nova Scotians, as well as organizing and advocating for an improvement to the rights of migrant workers in the province. We're also part of the Migrant Rights Network that advocates at the national level for migrant rights broadly in the country. So when we talk about migrant workers, they're also known as temporary foreign workers. So who are temporary foreign workers? So when we're talking about migrant workers, we're typically talking about migrant workers who are coming to Canada through the Temporary Foreign Worker Program. However, we know that there's many other non-permanent residents who work in Canada. So I just want to share just some numbers. So in 2021, there were 126,688 migrant workers who came to Canada or were working in Canada through the Temporary Foreign Worker Program. And of the workers that come to Canada to work as migrant workers, we know that agriculture is a key industry where they're working. And so in 2023, an estimated 70,000 migrant workers were working in Canada in the agriculture industry. And when we talk about the Temporary Foreign Worker Program, it's important to recognize that there's many streams and programs that are under the Temporary Foreign Worker Program. So for example, there's an agriculture stream, there's a seasonal agricultural workers program, high wage stream, low wage stream, global talent stream, just to name a few. In terms of the workers that we're working with my organization, it's typically low-waged migrant workers who are working in the agriculture industry, seafood processing industry, but we've also been reached out to by workers in the food service industry, hotels. We recently supported a mechanic who was a high-waged worker, paid thousands of dollars to a recruiter to come work in Canada and was experiencing abuse in his workplace. So let's see here. So in the work that we do, we have to have an awareness of, okay, what stream or what program are migrant workers coming through, because entitlements can be different depending on that. And this just looks at the kinds of work that migrant workers are doing, which I mentioned, agriculture is a key industry. So I want to talk about some of the health risks faced by migrant workers, and I will briefly talk about it because the other panelists will go more in depth. So I just want to give a intro. From the Nova Scotia context. So we know that migrant workers face health risks from a variety of factors. One of them is housing conditions. So there has been many criticisms of migrant worker housing as being often overcrowded, unsanitary conditions. And so I want to share the story of Orlando Rosas. He came to Nova Scotia as a migrant worker from Mexico. He was working in the hospitality industry. He was working in a hotel. And his cousin was also a coworker of his. So his cousin and other coworkers in this workplace were becoming ill due to a mold infestation in the employer-owned accommodations, and they had accommodations as part of their employment. And so Orlando was concerned. A lot of the workers were definitely also concerned, but were very fearful of saying anything about the situation. So Orlando was like a spokesperson to the employer about the concerns that the workers had regarding the poor living conditions. So he raised the issue of the mold to his employer, and no action was taken. He reached out to occupational health and safety, and it's important to note that for many migrant workers, their first language may not be English. So in the case of Orlando, who's from Mexico, and so, but in Orlando's case, he was fluent in English, so he had that. Yeah, he had the ability to language abilities in English, and so he was able to advocate in that way, and they were slow to respond. So then Orlando decided to go public with his story. So he spoke to CBC, and they came out with his story. And in the article, there's pictures of the mold infestation, mold on his clothing, mold in the bedrooms. Just it was, yeah, it was very clear that there was a significant mold issue. So this is one example. Unfortunately, what happened in that situation? So occupational health and safety officials ultimately did come. I think the media attention caused them to act quicker. And so they came, and when they came, they said, okay, this is unsafe housing conditions. This is not within our jurisdiction. So then they said, okay, it's not in our jurisdiction, but we'll send it to the Department of Environment. Department of Environment said, this is not our jurisdiction. So this situation not only highlights the poor living conditions migrant workers face through their employment, but also the lack of protections that there are, the gaps that exist. I also want to talk about during the situation during the COVID-19 pandemic. So we know that migrant workers were at increased risk of becoming ill because they were living in group settings. And so the National Advisory Committee on Immunization recognized that migrant workers were a particularly vulnerable community, and they made recommendations that migrant workers should have early access to vaccines. We know that thousands of migrant workers throughout the country became ill. And there's a number of migrant workers in Ontario, at least 9 who died from 2020 to 2021 in relation to COVID-19. So these are the photos of some of the workers. So we have Bonifacio Eugenio Romero, Juan Lopez Chaparro, and Rogelio Munoz Santos. It's important also to note that that there has been analysis of why did these workers pass away. So experts and advocates say that these deaths were preventable. According to one study which reviewed the coroner's reports from these deaths, one key issue was difficulty accessing timely medical care. And we know through our work in Nova Scotia that there's many issues faced by migrant workers in accessing healthcare, where, for example, most migrant workers in the agriculture sector don't have their own car, so they have to rely on their employer to go shopping, to be able to get medical attention. And in the seasonal agricultural workers program, there is a requirement for the employer to support the worker to get medical attention. But we know that that there's often delays in terms of workers actually getting attention. So, for example, on a farm that's in Nova Scotia, workers have reported, and this is in a workplace that employs around like 100 migrant workers, that when the workers request to be taken to the hospital, the employer will wait until other workers are also making that request so that a group of the workers can be taken together instead of the workers getting the timely medical attention when they're requesting it. So migrant workers are promised access to healthcare coverage while in Canada. This is an excerpt from a document put together by the Government of Canada called Temporary Foreign Workers, Your Rights Are Protected. So here it says, you'll have access to free healthcare under the health insurance system of the province or territory where you're working. However, when you first arrive in Canada, it may take some time before you're covered by the provincial or territorial health insurance system. Your employer will help you set up health insurance coverage as required by your province or territory. So that sounds reassuring, but unfortunately, in practice, migrant workers, for example, in Nova Scotia, do not get public healthcare coverage, and I'll talk more about that. But I also want to talk about, as you may have heard, there has been a lot of criticisms of the temporary foreign worker program. And in I believe it was actually last year, the UN Special Rapporteur on Contemporary Forms of Slavery issued a report about the conditions faced by migrant workers in Canada. And he called the temporary foreign worker program a breeding ground for contemporary forms of slavery, which puts a lot of power in the hands of the employer. And this is due to the closed work permit system, which binds migrant workers to one employer. And like many of the migrant workers coming through the temporary foreign worker program have closed work permits. So the UN report also pointed to the issue of interjurisdictional inequity. So basically, what this means is if a migrant worker, let's say is employed through the Seasonal Agricultural Workers Program, they don't get to choose their employer or even what province they're going to work in. So let's say a worker will get sent to Nova Scotia. Their right to healthcare coverage is different than a worker coming to work in Canada under that same program and being sent to work in Ontario. So let me see. So in Ontario and Quebec, migrant workers who are employed through the Seasonal Agricultural Workers Program have public healthcare coverage on arrival, at least in theory, according to the policies. In Nova Scotia, that's not the case because in Nova Scotia, migrant workers must have a 1-year work permit to be eligible for provincial healthcare coverage. And when you take a closer look at the Seasonal Agricultural Workers Program, under that program, you can only be employed in Canada up to 8 months of the year. So even if a migrant worker has been coming to Nova Scotia for decades, up to 8 months of every year, they don't have a right to public healthcare coverage. So this is the issue of interjurisdictional inequity that the UN Special Rapporteur is making reference to. So we know that migrant workers are important community members, pay taxes, pay into these social safety nets, but are being excluded. So migrant workers then, let's say they don't have the public healthcare coverage, but they're supposed to have the private healthcare coverage until they have access to the public healthcare system. But as I just shared in Nova Scotia, that never happens. So they only have the private health insurance. Instead. And we know that private health insurance is very limited. So we were supporting a worker from Mexico. We reached out to the private healthcare company, and they had told us that worker only has access through his coverage to one non-emergency visit to see a medical professional a year. So that's how limited the coverage is that workers have while when they only have access to a private health insurance. And this is just an excerpt from the report that I referenced from the UN Special Rapporteur. And I know Kerian will be sharing and really highlighting in practice just what this lack of healthcare coverage, how that impacts people. So what can be done? So these are just some news clips. Kerian bravely spoke out and shared her story. So I'm just going to share a few of the clips, but I won't go too much into it because I know Kerian will be sharing. We know that a lot of migrant workers, due to the heavy risks of reprisals that they face in speaking out, don't speak out publicly about the conditions that they're facing. Kerian made the brave decision to speak out publicly and really shed a light on these issues in Nova Scotia in Canada. So here's another news article. And here's some photos of some of the public campaign that we had, calling for healthcare for all, calling for the provincial government to extend healthcare coverage to Kerian. And here's a photo of a press conference that we held when it was announced that Kerian had been successful in getting provincial healthcare coverage. So let me see. So what can be done about the situation? And maybe before I go into that, I do want to acknowledge, so we're in Nova Scotia, it's pretty glaring, the policy issue that's in front of us. Migrant workers and everyone should have access to provincial healthcare coverage, regardless of immigration status. But we know that that's not enough. We know that that's only one step. That will be a step in the right direction. But I want to share a bit about the Ontario context. So we know that in Ontario, as I mentioned, seasonal agricultural workers have a right to provincial healthcare coverage on arrival. But they still face many barriers in accessing healthcare. So there's a 2016 study which drew on a survey of about 600 migrant workers in Ontario. And they found that there were common barriers experienced by migrant workers in receiving adequate care, which included fears in reporting illnesses, long hours of work, coupled with limited knowledge of the healthcare system, lack of independent transportation to clinics, limited clinic hours, and once there, long wait times, language barriers, and cultural barriers. That's like a multitude of barriers that migrant workers are facing to access basic healthcare services. And so there's another aspect that I also want to point to. We've talked about the role of employers. And so we know that healthcare access is often being put in the hands of an employer. And we've seen just the many problems that this causes, but also when migrant workers don't have access to provincial healthcare coverage, they only have access to a private healthcare coverage, which is tied to their employment. So that is an issue. If workers get fired, or for whatever reason their employment ends, they would lose access to that private and limited healthcare coverage through that insurance. But we also see other issues such as the patient-doctor confidentiality being violated, with employers being in the room with migrant workers when they're seeing a medical professional. So that's an issue. I know one time we went to go support a migrant worker to go to the hospital. Because sometimes that's the kind of supports that we're providing. And so he didn't want his employer to know. And yet when he went home later that afternoon, his supervisor already knew that he had been to the hospital. So that's just an example from our work. So we've been advocating for expanding healthcare coverage to migrant workers. We know that in Ontario during the pandemic, there was a policy where it was a temporary measure to reduce the spread of COVID-19 by ensuring that any uninsured person in Ontario had access to necessary medical services in a hospital. So we know that it can be done. And we know that if this is not done, that this is very costly for people's health. Also means increased costs on the system when there's not early prevention and support. And also, in addition to advocating for provincial healthcare coverage on arrival, we and migrant workers and migrants throughout the country have been calling for permanent resident status on arrival. We know that if people have permanent resident status on arrival, that they have access to essential services like healthcare coverage, and they have job mobility to be able to leave and find another job if they're in a situation of abuse. Right now, it is a very challenging situation. I talked about the closed work permits. If migrant workers are in a situation of abuse, they have to be able to prove that they're in a situation of abuse to be able to apply for what's called an open work permit for vulnerable workers. And that is only a temporary measure of up to a year. So what we have currently is still quite limited. So that's it on my end for now. Thank you.
Hello, everyone. Good morning. My name is Kerian, former migrant worker from Jamaica. I came here in 2022 for greener pastures, as they would say, because when we're in our country, we would hear a lot about Canada. We would hear about Canada's healthcare. We would hear about that they have the best healthcare, which is a no-no for me. And we hear about the work programs here. So people there, because of lack of employment, they would be glad to get just a farmer card, that's what we call it, to come to Canada for working. But coming to Canada was a different experience for me. So after I came here, started working in Nova Scotia for a couple of months, I started to face sickness. So I went to my employer, my supervisor, and I told her that I wanted to go to the hospital. She told me that they have to book appointments for the hospital. So I asked her if I could get an appointment. She said to me that the appointment that they had was finished for the day. So I said, can I get another appointment for tomorrow or another day? She was like, we don't take people to the hospital like that. So I was there. She told me that maybe I'm coming out with the flu, so I should go home and relax. So I went back to the bunk where I was staying, and I was there, but I wasn't feeling any better. She came there the following morning. She didn't try to come and find out how I was doing or anything. She was just downstairs talking with other workers. She went back to the farm. One other supervisor asked where was Kerian. So a couple of the girls told her that I'm at home and I'm sick. So she asked if I went to the hospital, and the girl said no, the supervisor didn't want to take me to the hospital. So that supervisor called her and said, you need to go and take her to the hospital. She came and she said to me that a waiting period is at the hospital like 15 hours. And if I want to go, so I said yes. So she said to me, put yourself together, take a book, take your cell phone, take your chargers, whatever you need, a snack, water, juice, whatever, because it will be a waiting period, which I get my stuff together. Then I called her and she came, took me to the hospital, and she left me at the gate. So when she left me at the gate, no, I went inside and started asking questions. So that's how I was told to go to sit down, and then I would be triage and whatever. So when I after I did the triage, I was there waiting for probably 14 hours. Then I saw a doctor and I was ordered some blood works, and I did the blood work and all of that, and they didn't find anything. So I was given some naproxen for painkillers to go home to take, which when I went to the pharmacy, the insurance didn't cover it, so I had to buy it from my pocket. I still haven't been reimbursed for it. So I went back home. I was given a couple of days. I think it was the Wednesday, so I was given the weekend. So I went back to work the Monday. I work all week, right back till the Saturday. And I was at the house the Saturday. One of the girls came and said, you're always inside the room, so let's go walk. So we went out and we had a walk. Went to another house because they had multiple houses. So we went to another one of the house. And when we were coming back, we stopped at the gas station to get some Gatorade and stuff. So when I was inside, I realized it was raining. So I said to her, it's raining. So I didn't have a coat or anything. So she had a sweater around her. So she took the sweater off and she said, you put it on because you're always sick. So you put on the sweater. So we put on this, I put on the sweater, and we were walking back to the house when the rain came down, and we got wet, but it was close to the house. When I went inside, I remember I drank some of the Gatorade and I ate 2 biscuits, and I went on my phone, lie down, and I was watching something, and I started feeling some pains again. But this time when I started feeling the pains, it was like, it was unbearable. So there was one girl in the room, so I said to her, because 4 of us share rooms, I said to her, go downstairs and ask, who is Antoinette, and tell Antoinette I call her. And she rushed go downstairs and she asked, and they came back up. And when they came back up, she said to me that, what is happening? And I'm telling her how I was feeling. So she said, you want some soup? And I said, yes. And she went downstairs to make the soup. But by this time I was like, I couldn't breathe. I was more like I have an asthma attack or something, which I used to have asthma when I was a child, but I haven't had it since. So I didn't know what was happening. But by the time she came back up with the soup, I was like gasping for breath. So I was so scared. So I ran downstairs. I just passed everybody and I ran downstairs, and I was running outside the door, but it was raining. So one of the girls held me back and said, no, you can't go outside. It was raining. So they put me to sit down. And at one point I couldn't even talk. One of the girls, she had asthma, so she rushed upstairs for her pumps, and she came back and they were giving me puffers, but it wouldn't help. So one of the girls called the supervisor and said that I was sick. And when she called the supervisor, I can remember she came and she put an headpiece in my ears, and I could hear the supervisor saying, Kerian, you need to calm down. You're having a panic attack. You need to calm down. You're having a panic attack. And she was shouting, so I pushed the thing away from my ears. Then I was there, and I just felt like I was going to die. So I said, I'm going to die. And 2 of the girls rushed, and they went to they have a barn. So they went to the barn to see if there was anybody there to take me to the hospital, because it was a Saturday. When I was there sitting down, I heard like a vehicle driving, when I realized it was the employer. So he came there and he was asking what is happening. So the girls was telling him, because I couldn't talk at this point, so the girls was telling him what they saw happen. So there was and I heard cars coming again. There was another lady that she came there to purchase a cattle from the employer. So she was a nurse, so she realized that something was happening. So she drove and then she asked questions. I couldn't tell her what is happening. So the girl started explaining. So she took the puffer from the girl and she started giving me the puffer and telling me to have like deep breaths and so forth. And she was just there trying to help. At this time, the employer told one of the girls to call the supervisor and tell the supervisor to send an ambulance. I was there for like probably the next 45 minutes. There wasn't an ambulance, nothing. That's when he walked away. That's the employer walked away. And when he walked away, he went on his phone and came back. And like probably about 20 minutes or so, there was an ambulance. I could hear them coming. So when they came, the fire truck came first. And when they came, they were asking me questions. At this point, I could respond to some of the questions. So I was answering. And then the ambulance came. When the ambulance came, I asked if I could get somebody to take me to follow me to the hospital. Well, this time, because the supervisor wasn't there, I was granted the permission for somebody to follow me to the hospital. So when I went to the hospital and they run some tests again, they said I had an abscess and it's like 9 centimeters. So they had to go through an emergency surgery. So they prepared me for the surgery. I went through the surgery. I did the surgery on the 23rd of June, 2022. I went home on the 30th of June. By the 10th of July, I was feeling the same pain again. This time, I was at the house. I wanted somebody to take me to the hospital. I was told that the supervisor was coming, but nobody could follow me to the hospital. So she took me to the hospital. She left me again. So I went inside, sit down. At this point, I'd done the surgery like 13 days ago. So I still was sore, so I had to sit in a chair. I was there for hours waiting. At one point, I was crying because I was in so much pain, and a lady came up to me and she said, "You wanted me to help?" And I said to her, "Yes." And she said, "What you want?" And I said, "I want her to call somebody." And she went to one of the triage nurses and she told the nurses what was happening, and they came to me and they spoke with me, and I was there probably like for the next 20 minutes. Then I heard my name calling and they came and they took me inside and I was given a bed and I laid on that bed for hours before I could see a doctor. But at least I was more comfortable because I was laying down. And I was there and happened that they said the abscess came back again. And this time it's like 4 centimeters. So I was admitted to the hospital. I was on antibiotics. So I was supposed to go to Halifax to like draw whatever liquid that is inside the abscess because I couldn't go through a surgery that quick again. So I stayed about a week in the hospital. I went to Halifax the 19th of July. And when I went there, they did a CT scan. The doctor said that the abscess has gone down from 4 centimeters to 2. So it was no need for them to go through the process to draw the liquid from it. So they sent me back home with antibiotics. I went back to the previous hospital that I was, and then I was there for the night. I went home the following day. When I went back the following day, I was just there feeling some pains, but I was in dialogue with the doctor. So the doctor told me that she was going to do a biopsy and a pap smear, which she did. About a week after, she told them to extradite it. So about a week after the result came back, when the result came back, she called me and she said to me that she wanted to do a deeper biopsy because based on what she's seen, something is wrong, but she can't detect exactly what it looks like cancer. So I told my employees what was happening. By this time, that this was the second flight now, because the first time when I did the first surgery, they came to me in the hospital a couple of days after saying that they're going to send me home. So they said they were going to get in a meeting and then come back to me. They never come back. So this time now, when I was supposed to go back to do the procedure on the 12th of September, they booked a flight for me for the 14th of September. So I told the doctor what was happening. And the doctor said to me, okay, we're going to do the surgery before the date that was announced. So I said, and when I do the surgery, what am I going to do? She said, play along with them. So let them think you still don't do the surgery. So I went on the 8th of September and I did the procedure. And I went back home like nothing happened. So when the 12th came now, I went back to the hospital and I sit there for a couple of hours. And then I went back home like nothing happened. So when the result came back like a week after, she called me on the 16th of September, and she was like, the results are here, and it's not good news. And I said, what is it? And she said, you have cancer, and it's 2 places. And she said to me that basically the cancer is like a stage 3, and one is like a stage 2, and the other one is like a stage 3. But she said to me that the equipment to do the MRI at the hospital wasn't clear enough, so she's going to send me to Halifax to get a better reading. So she did send off the papers to Halifax. So I was waiting on the date. So I was there in October. The supervisor came there on the 4th of October, and she said to me, did you hear from diagnostic? And I said, no. And she said to me, well, this must be it. And she handed me a letter. I was preparing something to eat. So she said, when you finish, just call me and tell me what happened. And she went away. So when I finished, I went in the letter. I realized that the MRI was for the 20th of October. So I called her and I told her, no, she came back on the 6th of October. And she said to me that she talked to the consulate, and the consulate is not telling her anything. So she contacted Service Canada, and Service Canada advised her on what to do. And her decision was to send me home. So she gave me some documents. She booked a flight for me, and the flight was on the 12th of October. So she wasn't even giving me a chance to do the MRI to see what happened. So she said everybody in that house that I was staying was going to go home also, which there are other houses there that are open, but she just wanted to get rid of me. So she was just closing that house for everybody to go. So I was there talking to her until she said, when she finished talking, I said to her, well, you booked a flight, but I'm not going to take that flight. So she said, where are you going to stay? And I said, even on the streets, but I'm not going to take that flight. She went away. I called the liaison officer, that's a consulate, and I said to him, how was I fired from June 21st, even before I did my surgery on the 23rd, and I don't know about it? And he said to me, who told me that? And I said, the supervisor, and I have it in writing. So he said to me, send me a copy of the papers that she sent to you, that she gave you. And I said, okay. So I sent him a copy of the papers. He called her, and I don't know what was spoken, but the following day she came back early in the morning and she said she wanted to speak to me privately. And I went upstairs and we closed the door and we were there talking, but she was just like, can I have back the letter that I gave you yesterday? I have a new letter, and she just wanted back the letter, So I was like, sure, no problem. So I was there and she was talking, is there anything that we should have done that we have not done for you? And she was just questioning. It's like she was trying to feel what I was thinking or whatever. So I said to her that I hold no grudges against nobody. So I told her that I don't think that the liaison officer did enough for me, though. He was the one that was supposed to fight for me, but I don't think he did enough for me. She was there talking at one point. She had teary eyes, and she said to me again, can I have the letter that I gave you yesterday? So she said she thinks that letter was inappropriate because she was going through something with another staff, and because of that, I was badly treated because of what the other staff did. So I went to my suitcase, took out the letter, I gave her the letter. She gave me another one, and she was there for a little while, and then she left. She gave me an envelope, and she said to me, don't let the other girls know that she gave me an envelope. So there is money inside the envelope. So when I opened the envelope, it was $250. So I went downstairs, and the other girls were there, and I called her name to them, and I said, the woman just gave me $250 a while ago. So we were laughing about the situation. So I ended up giving one of my friends $50, saying we were going to town. So I said, take this $50 and I'll take the other one. And we went to town. By the time I reached town, I realized the liaison officer was calling me. And when I answered, he was like, is there anything that he should have done that he has never done? And he was asking me some questions. So I said, listen, I'm in Walmart now getting some medication, so I have no time for this. So I'll call you back when I leave. I did not call him back. So there were like many times where he would text and he would say, look, I have to go home. And he would try to tell me that he's in charge of me and stuff like that. So the last time he texted, I told him that, listen, I'm not illegal here. So I would wish for you not to continue texting me, because I think you're trying to put me out of the country. And he said, no, I'm not trying to do that. I'm just looking out for your best interest because going through chemotherapy and you don't have any family here and all of that. They were just trying to convince me to leave, but I told him that I wasn't going to leave. When I started chemo, when I reached out to Center for Migrant Workers and we started to try to find a place to stay, we started to try to advocate and all of that. And when I went to the hospital to purchase medication for cancer, I realized that my insurance was gone. So I had to pay for it out of my pocket. There were times when I went there for like blood tests, scans and so forth, and I was denied because I didn't have any health care. So sometimes I go to the hospital and I came back in tears. It was like embarrassing when sometimes I'm in a line and people behind me and I was denied medication and I have to turn back looking at all those people without no medication. So sometimes I left there crying, but I think I overcome. There are times when I talk about this and I would cry, but I think I'm getting better now. But there's a lot of work still left there to be done. So just have to try and continue to fight because I may not benefit, but anybody else that is coming, I don't think I don't care about myself at this point. I care about who coming after because
generation.
Yeah, we know what is happening. So I'll continue my fight until I can't fight anymore to see a change for every other migrant, whether Caribbean, Mexican, anybody. I don't care, just anybody. So that was a part of my story. So thank you everyone for listening.
Hi, everyone. We're a little pressed for time. A couple of things. Thank you, Kerian, for sharing your story. Canada has a culture of
Silence.
why are you so loud? Silence. And in my country, in our countries, no news is good news. No news is good news. When I got the opportunity to work in Canada, I thought I was coming to the perfect place. No news is good news. Culture of silence. Only to find out when you come to a country with a culture of silence, and migrant workers are forced to be quiet and submissive. A culture of silence, and you're forced to be quiet and submissive. Isn't that powerful? In our country, we see that as good news. But only to find out in Canada, migrant workers are forced to be quiet and submissive because of unjust laws, unjust policies. Let us get into some of that. It's difficult we'd never have enough time, but two people will win a copy of the book because we can never have enough time to share our story. But the things that I'm not prepared, we have to figure out a way of you writing your name and we'll do a raffle. I don't even have a strip of paper to share. Can you? Yeah, I want to tell you some simple things. What are the people that are planting, picking, packaging, processing, do the distribution, even in the restaurants, preparing your meal? What are people doing all of that work? From the seed all the way to your plate. We'll not talk about who are the people who own the land and making the profit. We'll not talk about that. We'll talk about from the seed all the way to the plate. These are people, you just heard one story, and there are thousands of stories. Earlier, you heard from the previous presenter how many thousands of workers are involved. Next one for me, please. And we'll have to run. Basically, the program, and as you can see, since it took a lot of time, it is very difficult to understand it. It's so complicated. It is so complicated. It's difficult for migrant workers to navigate. You just heard one story. And it is in Canada, this is impossible to get justice. Next one. A few things, because of time, I don't have to run. I want to tell you that I personally believe that the food that we're eating, and thank you for feeding us. Did they give you a complete meal, a balanced meal? If you didn't do that, I'll charge you for that. I personally believe that they say if we eat well, food is our medicine. And if we don't eat well, they say medicine will be your food. And I also believe that who controls the land controls your food. And who controls your food controls you. Are you concerned? Are you concerned? In Canada, it is legal. It is legal. Nothing, everything that have been said, it is legal. It has that's why I like to be loud in Ottawa. That's why I like to be in Ottawa. Why? That is where the unjust laws have been made. Right under your nose. Right there under your nose. Are you aware of that? Right there under our nose. And it is illegal to exploit the soil, to exploit the environment, to exploit marriage. It is illegal. Nothing illegal. But it's quite quiet. Culture of silence, and migrant workers are quiet. And in my country, I see it as good news. It must be a perfect place because nobody's saying anything. And that is why I'll have to figure out whether I'll punish you, because you never told me about it. You never wanted. I'll have to figure out whether we should punish you or whether we should reward you. I don't know. But I have 2 books there. I think I'll punish you with the 2 books. So there's so many things, but I want to tell you a few simple things. That the food system is built on race. Regardless where you go, food, clothing, shelter, these are basic things. But in Canada, food is not a basic necessity. Food is a commodity, money making. Just like education, international student, money making, right? Lots of things are money making. So in Canada, food is not a basic human right. Food is a commodity. Can you go to the next one for me? And we have to run. What happened to? It doesn't want to run? Okay, basically just what I said, food is not a basic necessity. At the end of the day, look at that. At the end of the day, don't you like to see your presentation, the way the food is presented? The more colorful it is, the more balanced it looks and so on. Similar to Canada's culture. The most diverse, the most multicultural. Isn't that great? But are we truly all treated well? Somebody told me yesterday, when the tide goes up, all the boat goes up. That's one of the principles of Canada? We do better when everyone else does better. Isn't that a principle? Canadians believe in that. We all do better when others do better. Think about it. Next one from that. Okay, I'll skip that. I'll skip that. Oh, okay, let me because it's kind of similar. We're coming from the global south. I want to tell you, I'm coming from an island in the global south, St. Lucia, and a couple of things. During colonization, my country was colonized by France and England, and they used 3 C's to colonize us. And I want you to read, because we're in the school, I'll give you some assignments. Assignment number 1, I want you to read about colonization. They used 3 C's: sugarcane, C; cricket, C; and Christianity, C, to colonize us. And during colonization, we know about slavery, but not just slavery, but barbaric slavery. We know about genocide. Next one from place, we're running. Emancipation emancipation in the British West Indies was in 1838. Something significant happened in 1844 that led to emancipation. I want you to read about indentured workers. I like to tell people things in a way you'll never forget. If you were to cut me in half, and I wanted to bring a sharp knife, but I couldn't get a sharp knife in Ottawa. If you cut me in half, one part of me is from my mother's side. My mother's side came in as Africans, exploited as slaves. The other side of me is my father's side, came in as indentured workers from India. And after emancipation, indentured workers were brought and exploited. Can you go to the next one for me? Another assignment I want you to read about is neoliberal policies. Because Kerian was forced to live here, to leave her home country. Difficult condition. I have some workers there. We are forced to leave our home country, not with a gun to our head, but because of neoliberal. And that is something I would like you to read. Neoliberal policies. Can you go to the next one? Because of neoliberal policies, we have high unemployment. And here's a professor came up with that word. I've never seen it in the dictionary. What is it called? Flexicurity. What is that? Flexicurity. And I have a prop for that. You can never forget that, right? Kerian's story, we are sandwiched. We are sandwiched. We are caught between a rock and a hard place. In our home countries, because of neoliberal policies, we are forced to leave our country. Come to Canada, difficult working and living condition. So the word flexicurity, what do? Stay in a country where unemployment is high, or come to a country where if it's difficult working and living condition? What do you do? Flexicurity. Okay, you heard a little bit about that. This is not an exam. That will not come up with your exam. But you can see statistics touch it. Workers are coming from literally. They're working every province. What I want you to know, because we're in Ontario, I'll be a little louder about Ontario. You can see Ontario 2015, 2022 has the lion's share of workers, right? Leave it as that. Stacey touched that. These are the three main programs that bring in workers to work in agriculture in Canada. And that program that Stacey kept emphasizing, you'll never forget that, right? The Seasonal Agriculture Workers Program. Workers are coming from Mexico and the English-speaking Caribbean. What is important is that those workers, they come for a maximum of 8 months. Those are the two other programs, the agricultural stream, the low-wage stream. Where are they coming from? All countries. What I want you to know, they're coming from all other countries. Is it a case where you can come from any country and come to Canada, or is it that the employers can get workers from any country? Which one do you think? And regardless of which program that you're coming under, what is important? What's the bottom line? They're tied to a specific employer. Tied to a specific employer. Next one for me. In school, I couldn't spell debt. And by the way, the organizer here, he asked me to make an announcement. He said, if any of you is in debt, after the session comes to me, we'll write you a check and settle your debt. But for me, I cannot spell debt. But in Canada, what I discovered in Canada, debt stands for denied, excluded, untied. Denied, excluded, untied. And at the same time, in Canada is telling people from Europe, DDT. DDT. What does that mean? People from Europe. Deny your freedom. Deny your right. Tie you to your employer. But workers from the global south, we will deny you, exclude you, and we will tie you. Can you run for me? Yeah. Look at that. And that's enshrined in Canadian law. Can you go to Parliament right now? It's enshrined in Canadian law. We are denied the right to vote. Participate in culture and community, participate in family life. We're in February. In February, there was a holiday. Your best days in Canada, migrant workers' worst days in Canada. And that's enshrined in Canadian law. Is it wrong? People who have a party and having a good time that wrote those laws? From 1966. Enshrined in Canada. Is that an accident? Or is that by design? Can you go to the next one? Another name for migrant worker in Canada is excluded. Look at let us take Ontario, for example, and that's what Stacey was trying to emphasize. Look at in Ontario, the province of Ontario, overtime pay, excluded. Minimum wage. What is the name? What is it? Minimum. What is it? You know what I mean? Minimum wage, excluded. Minimum. The minimum, excluded. Hours of work, excluded. We work from sunrise to sunset. Sunrise to sunset, no overtime pay, excluded. Daily rest periods, weekly rest periods, excluded. And you even to unionize and to organize, we excluded from that. So we do non-unionized work. Can you imagine that? What's another name for migrant work in Canada? Excluded. And as Stacey tried to point out, that in each province, they have their own labor laws, right? I have a question at the back. I excluded you or you want to be included?
No, I guess my question is, are the migrant workers paid an hourly wage? So when you say overtime, it would be a formula of like an extra amount. So if you say they work from morning to night, so 10 hours or 12 hours, are they paid for 12 hours of work? Or you're saying they're paid for 8 hours of work and they work 12 hours?
Wording, do we answer questions now, or do we want to hold off until the questions?
Clarify the question.
No? Yeah, thank you. A couple of things. Overtime pay. On the farm where she worked, there's something called piece rate. You know, piece rate, they have you running, and based on productivity. And the workers told me, that's what workers keep telling me, when they work out their pay, it's working below minimum wage. And it's called piece rate. And that is something that is and I call it variable piece rate. Variable. In my country, if they ask you to do that for the day, at the end of the day, you did it, you didn't know, you know where it's done. But variable means that they have you, they keep on moving the goalpost. So what I mean is today you may do that and be satisfied. Tomorrow the employer can change it to that. So you keep on running. And what do I mean by that? In my home country, I never ever use energy drinks. In Canada, energy drinks was part of my routine. I had to cut my lunch hour by 30 minutes. Sometimes start work 30 minutes before. forgo washroom break just to meet and exit because they keep on moving the goalposts. Can you go to the next one? Stacey said in her presentation, what did she say? Low wage. A millionaire in Ontario said, a multi-millionaire in Ontario said, there are two ways to make money. You build value or you cheat other people. Which one do you think I'm going to talk about today? And in Canada, look at how smart the politicians are. Look at that. They disguise it as low skill job. Look at it, low skill job. So because it's a low skill, look at it, that one word, low skill. Will you not accept these guys should get low wages, but they should get precarious conditions and no labor? Because that's low skill. Something important like food, low skill. Are you going to be a spectator and watch? Or are you going to be a fighter and fight? Can you go to the next one for me? That point here, I cannot overemphasize that. Regardless of which program we come under, it is for a period of time, whether it's up to 8 months under the Seasonal Agricultural Workers Program or 2 years. But what is important, it is employer specific. You cannot work for anybody else. And what is that? Look at another important thing. The employer can terminate and deport workers without cause. The employer controls the travel agency that's bringing our flights in and out. I have a colleague of mine here. She's at a conference, CFA, Canada Federation of Agriculture. They're having a conference there right now. Canada Federation of Agriculture. All those things I'm talking about there, it is illegal. Illegal. Can you go to the next one? Yeah. Can you, because of time, I'll have to run. Can you go to the next one? Next. Okay, this one here. If you can, I have 4 circles there. I want to take you full circle. If you understand these 4 circles, we can live now. Okay, listen to that, 4 circles. In the inner circle, we have migrant workers. The next one, the farmers, Canadian society, the government, and I have a 5th circle here. The country, Canadian country. Where do I start? The migrant workers. Who is a migrant worker? Denied, excluded, and tied. We're coming from the global south. And what is happening? Look at that. This is the migrant workers. Look at one layer of trouble. The farmers. The employers. The HPI, is that a science course or economics course? HPI, what is HPI? The employer has there's a high power imbalance. Imagine the employer controls every aspect of our lives. That's what Kerian was telling you about. You can hear that story. She depends on her supervisor, depend for housing. They control every, that doesn't make you a human being in Canada. Every aspect of your life has been controlled. And look at that. And what has happened to the Canadian society? Canada has a culture of silence. They say nothing about it. Should I punish you or should I reward you? What should I do? The culture of silence. And also, the part of the problem too, and that's why I'm happy to be here, the 5 days of Canada. Some Canadians are good at denying that problem exists or downplay it. It's not as bad, it's worse. And they deflect the call. All the days of Canada. Oh my, why does Canada have a D grade today? Let us go to the government. And the government, during COVID, they said, they gave us a promotion. They said that we are essential workers. Isn't that a comforting word? But look at the conditions there. Comforting words of the poor. They're the ones creating the unjust force. I want to tell you, look at what is the problem I'm trying to talk about there? PPP. What's the problem? PPP. But it's election here in Ontario. That must be a political party. I'm fine with that. PPP. The problem P is the unjust policies of the politicians. We're not saying the politicians are bad. We're not saying Canadians are bad. We're not saying the farmers are bad. What is the problem? The unjust policies of the politicians. And look at that. Of the 5th circle there, the Canadian country. Canada is very consistent. How many of you are consistent in school with your grades and attendance? Are you all consistent? Canada is very consistent. Canada is consistent. If you look at Canada, tell me a year and I'll tell you. Canada consistently have programs that dehumanize and exploit people. Canada is very, very consistent about it. Because of time, I'll go to the last, the one before. Keep going. Okay, here, I want to point out, that's another assignment I want to give you. I want you to read about the SDGs, the 17 SDGs. Number 1, what is number 1? Only you know that. What is number 2? Zero hunger. And number 8, decent work. Look at that. Isn't that a great world to live in? No hunger, no poverty, decent work. Isn't that a great world to live in? In 2022, I went to the UN and Canada was giving the half-year report. They said they're on track. At time of COVID, they said they're on track. On track for what? At 2042, they're hoping to create that kind of world. Are you aware of that? And what are you going to do? And to, can you go to the last slide for me so we can get some? Okay, no, sorry, backtrack from one. Yeah, right. Quickly, this is called the power wheel. Where do you fit in here? I want to tell you, as students, everybody have power here. Everybody have a skill. By now, you notice I have a big mouth or maybe a long mouth, but everybody have a skill. As a student, as a voter, you have skills. How are you going? Where do you fit there? And how can you use your power and your privilege to create a better world? And go to the last one. And if you want to take action, keep going, keep going, keep going, keep going, keep going. Yes, I don't know how I'll go about it. 2 people can win a copy of the book to read more. If you want to take action to create a better world, hey, would you join me by getting to using those QR codes to sign one? Amnesty International, there's a petition for open work permit for workers. You can learn more about it. You can also join and what's happening. But I have a couple of workers that were injured. I do not know if they want to share the story. And I don't know how much time do we have to for questions, Q&A. Thank you.
We have about 10 minutes, so perhaps what we can do now is open up the floor for some questions. Maybe that's how you'll get the books out. Whoever asks a question and get a book. Go ahead.
I would like to know how Kerian's story ends. I'd like to know if you had to pay any of the healthcare you received, if you received pay from the moment of your diagnosis in June, and what's your current situation? You can stay seated.
Because of the mic, I don't know.
That's okay. My current situation is I'm in remission. As to the bills, I applied for IFHP, that's the interim federal health plan. I had to wait like 8 months before I was approved. So that paid off all the bills that I owed. So I know I'm qualified for MSI in Nova Scotia because I applied for a work permit, a 1-year work permit. So I was qualified for MSI now, so I currently have insurance now.
So you can stay in Canada, you're like a
But
resident?
I don't have a permanent resident or a citizen, but because of the work permit, I can stay here until I get further paperwork done.
Thank you for sharing your story.
I just want to ask, very nice question, important question. Personal question. I just want to answer that. When they have a couple of workers here, and there are even more workers who get injured. Once they get injured, they have to make, it's a tough decision to stay back in Canada to fight. For example, injured workers in Ontario, we have when you get injured on the job, you have a case with WSIB. But is WSIB friendly or not? Lately, they've been making their surpluses in the billions. Their surplus, what is the word I use? Surplus. How do they get to the surplus to be so high? Is by cutting back on the benefits and making it difficult for the work. And for a migrant worker to stay in Canada to fight, they have to get their own housing. They're on their own, no income. The status is a problem. They have to and housing is expensive. How do you do that? How do you do that?
Yeah, I want to kind of ask a panel to see how you feel about all those barriers, systemic discrimination on healthcare, but that happened to all other, the social safety net in terms of workers' compensation and other things to access the EI, the migrant worker, undocumented worker, refugee worker. But look at in context of when we have people in the history from Europeans and things like that. Even right now, people coming from European as a refugee, or back in 1950, 40, when we have a migrant worker from European, they get the status right away after they come here. But why Jamaican, Caribbean, Asian, Latin America people come here for how many decades since 1960? Still, they are not allowed to have a permanent residence. So racism in our system indeed could impact those people where that comes from. That they are not welcoming forever. Even think about the Chinese people who built the Pacific Railroad, and they died, so many people, but they had to pay head tax to come here in Canada. So what do you think about that?
Yeah, beautiful. From the very foundation of Canada, that's why I tell you Canada is very consistent. From the very foundation of Canada, Canada has been consistently using dehumanizing programs. And I want to tell you, in Canada, to access anything, you must have status. If you don't have status, you cannot access. You cannot. Status. And what does status mean? Status is a two-edged sword. If I have status, I'm not afraid of being sent back home because status allows me to remain in Canada. If I have status, I do not have a closed work permit. With status, I can work for anybody who's willing to employ me. So I'm not tied to an employer. So status takes care of our labor vulnerability. So what is status? It takes care of our immigration and our labor vulnerability. So when Stacey said we call for status, status is our Tylenol. It is our Advil. It takes care of our pain. Will you join the call for status? Our vulnerability is because of not having status.
So that's why we have some of migrant workers here. What we call, it's not just the healthcare. No, it's not just the EI. Migrant worker wants status on arrival. That's that end of the period.
And that is, as you said, this is not something new to Canada. They've done it already. So what is good for the goose, also good for the, there's no gun in it.
I just want to highlight one point.
How much time do we have?
The situation is so bad that even when you got injured, and you apply to immigration take away what you have and say you're now a tourist in the country. So they make it impossible for you to get any form of treatment here.
Yeah.
Because that is so atrocious.
And from 1966, so is it one political party? From 1966, and well before most of y'all, if not everybody was born, it had been happening. On our nose, but they make us invisible, and that is why we are really grateful for this opportunity to become aware. How can we change things if we don't talk about it? But did we just talk, or did we say something to push you to take action? I don't know. Will you take action? Tell me. And I need another question because I have another book to give away. Another question, and we are out of time. I guess.
If not, then I'm just going to conclude by thanking the panelists for very lively and personal account of the issues and the struggles that migrants generally, including migrant workers, face, as we heard, right? And also from audience members, many of these issues are multi-layered, right? With not just about the lack of status being an issue, but colonialism and racism, and also part of the very issue that needs to be conquered. Now, obviously, we'll take a multifold of approach, right? Access to healthcare is one part of it. Access to status is going to be another part. And when in the issue of in the context of injured workers, we know that access workplace insurance benefits is always it's already hard for Canadian workers to access that kind of benefit. It's only that much harder when you're a migrant worker, right? And I think that subject matter in of itself, we could have another, panel just on that topic itself, because that system is fraught with a lot of barriers. But thank you very much for everyone who showed up today. I hope that, they give you, again, a more lived experience perspective of what is it like to be somebody who do not have the security when it comes to either the safe working conditions, or once you're injured, or you're sick and you need healthcare, and that in itself is also precarious. So thank you, and have a great rest of the day.